Welcome to the Holistic Plastic Surgery Show, where we dive deep into the hottest trends in health, beauty, and cosmetic treatments. I'm Dr. Anthony Youn, America's holistic plastic surgeon. Are you, or have you ever been on birth control pills? Well, if so, then this week's podcast is a must listen. My guest this week is one of the nation's leading naturopathic physicians teaching about how birth control pills can be hazardous to your health. Every day, millions of women take birth control pills, not just for contraception, but for treating symptoms such as acne and painful periods. Are they really doing their bodies a service, or are they masking issues that will rear their ugly heads years or even decades from now? On this week's podcast, we discuss just exactly what is post-birth control syndrome, why women get it, and how to treat it. The symptoms often start 4 to 6 months after discontinuing birth control pills and can have devastating consequences for some women. We reveal other potentially better alternatives for contraception, and I even call out the guys by giving my perspective on the ideal form of birth control. So let's get started. My guest this week is a functional medicine naturopathic doctor and the founder and medical director of Robust Health, a root cause women's medicine clinic where she specializes in the treatment of hormone disorders, including adrenal and thyroid conditions and autoimmune disease. She's a best-selling author of the book Healing Your Body Naturally After Childbirth, the new mom's guide to navigating the fourth trimester, and she is the creator of Robust Pelvic Care. In her patient-centered clinic, she thrives on navigating the space between conventional and alternative medicine, all while working with patients to help them achieve optimum balance, health, and happiness. I'd like to welcome my good friend, Dr. Jolene Brighten, to the Holistic Plastic Surgery Show. Well, thank you so much for coming on the show.
Thank you for having me. I'm excited to be here.
So we're going to tackle a pretty interesting and very controversial topic today on birth control pills. But before we get into that, let's talk about how you became a naturopathic physician and your path to where you are now and treating the types of patients that you are now.
Yeah, so my journey really began in childhood. So I was one of those sick kids, not sick in the capacity of like I always had a cold and flu, but I had chronic digestive issues. And this went on for years. And I can remember being back at 7 years old and having all of these stomach aches. And it wasn't until I was 17 that I was diagnosed with H. pylori and chronic gastritis, which is not something any teenager should really get the diagnosis of. But, there it was. And they had discovered H. pylori at this time. So prior to that, we didn't know about it. And so through that, we had to heal my gut, which in conventional medicine looked like round after round of antibiotics. And then I was handed a proton pump inhibitor and told to go on my merry way. And at 17, I was told I would need this medication for life, which getting a 17-year-old to be compliant with a proton pump inhibitor, not going to happen. But, I had always been fascinated as a child in herbal medicine, in nutrition, and just these ways, what we call lifestyle therapies now, but these ways that were just daily practices of health. And so it was at that time I started to make observations about my meals and came to understand that if I was eating refined carbohydrates, I got heartburn. If I was drinking orange juice and having pasta, that was a bad combination. And I started to just figure it all out and realize that, there's a huge connection to diet and my digestive issues. So that's what really propelled me into nutrition. And I got my degree in nutrition science. I actually was studying molecular nutrition and working in a lab. Not a lot of people know this about me, but I actually came from a really hardcore science background, working in a lab, exploring things like sarcopenic obesity and how to leverage food as medicine. But it was through all of that I really became disenchanted as I came to recognize that so much that we were being taught in our program, now the science aspect, we were getting good science, but in the clinical application, there was a mismatch. And so, that's still when people were being told to eat 6 servings of grains a day and fat-free diet. And I did that. And I wrecked my health because of it. And all the while, through this, I was on the birth control pill. And so that's an important thing to note since we're going to be talking about that today. So I found naturopathy. I was totally passionate about it. It was the first time it made sense of what I was supposed to do in this world, bringing together the science, but also all of the lifestyle interventions I had been studying. And that's how I became a naturopathic doctor. And, it really, I was always passionate about women's health, about endocrinology, fascinated by the thyroid. And then it was after the birth of my son that I was gifted with Hashimoto's, and I developed postpartum thyroiditis. And that really got me interested in the intersection of autoimmune disease and hormones, and really the root cause of women's medicine, and how we really can leverage our hormones, our immune system, and really the whole body to have, overall wellness, but also just feel most like ourselves every single day. So that's a bit about my background and where I came from. Definitely a bit of a long journey there, but that's what's landed me to where we are today.
And you're primarily treating women now, and you've got clinics in both Portland and in the Bay Area, right? Is it Oakland?
Yep, I have a clinic in Oakland, California, and Portland, Oregon. Yeah, and we're Rubus Health from the herbs. So this goes back to my herbalism. Rubus ideas is the red raspberry leaf, which is most known for strengthening and nourishing the womb space. And so we're Rubus Health, and that's our role, is to really strengthen and empower women to be the healthiest version of themselves.
Yeah. Well, let's get into the topic of discussion today. And the topic really is birth control, and specifically post-birth control syndrome. So can you explain what post-birth control syndrome is, and why this has become such a passion of yours? Because I know that you are really one of those people on the leading edge of discussing this that, really a lot of patients and even doctors may not know about.
Yeah, this is a topic not a lot of people are aware of. And, so let's explain, what is post-birth control syndrome? So what it sounds like is there's a syndrome that happens when you come off of the pill. And so what this is really a constellation of symptoms that generally arise anywhere from 4 to 6 months after discontinuing birth control pill. Regardless of how long you've been on it, that we can see from the research is that there are certain symptoms that are worse the longer you're on it, but for the most part, if you take it once, it disrupts the way your brain is speaking to your ovaries, and that can cause a problem long term. So with post-birth control syndrome, the symptoms can be as drastic as a total loss of your period, a total loss of your fertility gone, or it can be as benign as like acne and hair loss, which I want to be clear that if you're experiencing acne and hair loss, that doesn't feel benign by any means. But on the grand scheme of things, when we look at it, losing your fertility, your ability to make hormones, that's pretty extreme. Having symptoms like acne and hair loss is telling us something's going on in the body. We can look deeper, but it's not necessarily so extreme that it's going to be a permanent kind of situation. And so it's just the way the body's starting to talk to us. So how I like to look at post-birth control syndrome is that it can be a resurgence of whatever symptoms you had before you went on the pill. So we know 60% of women are taking the pill for symptoms, not for preventing pregnancy. So when they come off of it, we can expect to see a rushing in of those symptoms again. And, some people will frame this as, oh, your body's rebelling against you, your body is misbehaving. And it's not. What it really is that you took the pill to suppress symptoms. It's basically like you muffled somebody, you put your hand over their mouth, you didn't let them talk for however long you're on the pill. For most of us women, it's about a decade or so. So when you stop the pill and you finally give your body the opportunity to speak, it is going to be super loud about that. It's going to get your attention any way it can because it really wants you to survive and heal. And so, one of the best examples we can use is polycystic ovarian syndrome. It's one of the most common reasons women get prescribed the pill because their periods are irregular. And so doctors will say, well, we can regulate your period by giving you the pill. The problem is that it's just a withdrawal bleed. It doesn't regulate the menses whatsoever. It's not working on that root cause. And the root cause of PCOS is a metabolic disorder. So in these women, when they're given the pill to suppress the hair loss, the acne, the irregular periods, when they come off of that, about, as close to 40% of them will never have their period return. And on top of that, things like diabetes and heart disease have been allowed to fester all of those years. So that's where I get really passionate about this because women deserve a root cause solution to their symptoms. They don't deserve to just be given a pill and told just suppress it, your body's misbehaving and go along your way, because that can be dangerous. And so that's really, what I get passionate about is that if you want to use the pill because you don't want to have a baby, I got your back in that. But if you want to use the pill because you're having heavy painful periods or acne and things like that, it's totally your choice. But I would like to offer women a root cause solution to that, so that one, they don't need a pill for life, and two, they don't need me as a doctor for life either.
So the idea you're saying basically is that it's kind of twofold, is that by going on the pill, you are going to mask these symptoms that have a cause to them, that you should try to get to the bottom of this cause, the root cause there of your problems, and it masks it for sometimes over a decade. And then the second thing is going off of the pill then can create significant problems. Why is it that going off the pill why will this cause these types of issues to develop afterwards?
Yeah, so that's a great question. And what is really going on is that the pill is depleting your body in a whole lot of ways while you're on it. So and while you're on it, you're taking this huge bolus of basically hormone suppression. So this is the basic mechanism of the pill. It stops your brain from talking to your ovaries. So, when you're on the pill, it's also depleting your nutrients. This has been well recognized. Since the introduction of the pill, we've got research that goes back like 40 years that's shown us things like B6 and tryptophan and zinc and magnesium, many of these really important nutrients to run our pathways, like having an elevated mood, so feeling good every day, synthesizing and breaking down hormones. So the pill is depleting that. It's also taking a hit on your whole endocrine system, because when you take the pill, it actually makes it so you can't make and use thyroid hormone or your cortisol as effectively, which is coming from the adrenal glands. And then the pill is also very well recognized for its role in leaky gut. So I think a lot of people know what leaky gut is these days. It's inflammation in the intestinal lining that allows particles that never belong getting through to your bloodstream to make it there. And that gets your immune system very aggravated. This is really at the crux of autoimmune disease. So we know the pill is also linked to autoimmunity in that way. And it's really all of these things that are taking place the entire time the woman is on the pill. And then on top of that, whatever was taking place before she got on it, that can make it so difficult once you stop. Because once you stop the pill, that's when the pituitary, so the brain, it starts trying to talk to the ovaries again. Now your body's no longer suppressed. The other thing that I found is that a lot of women are having issues while they're on the pill. So depression, women have been complaining about this since the 1960s when the pill was introduced. We've got lots of studies to support that, but it is a very commonly dismissed symptom in women's health altogether. And I want to be clear, it's a symptom. I don't think that women should be handed these diagnoses just outright saying like, oh, you're just depressed and go, that's it. Here's a different pill for that. We really need to be asking, why is your body expressing in that way? So, you can hear from what I'm saying. I'm all about root cause resolution. And this has been me since childhood. I got to know why, and I'm tenacious about it. I want to know why in every patient, and then I want to empower them and give them the tools to really recover their body after birth control, because there's a lot of work to do there. And if you've ever been on the pill and you haven't gone through healing up your gut and making sure you're building up your nutrient stores, you're still going to have to do that work. It has to be done at some point.
Yeah, and you and I, we both know that today's healthcare system is really not so much based at finding the cause of these issues, but treating what are the symptoms. And so, we see that. You're talking about with birth control pills, but we see that with other types of issues too. Somebody has, let's say, hypercholesterolemia. They've got high cholesterol. Let's put them on a medication. Okay, it's not the fact that the standard American diet is causing this for you. It's it's that we put you on a medication to treat it. So the whole idea, I think, that I really admire about naturopathic physicians is this idea of, okay, let's get to the root cause of your problems. The root cause of your problem is not lack of medication that you're taking. The root cause is maybe it's your diet, maybe it's what you're exposing yourself to, maybe it's your lack of activity or your stress level, and getting to those causes are so important. So if somebody gets off of birth control pills and they're having these types of issues, let's say they come and see me and they say, hey, I've got some hair loss and my acne is really flaring up. What do you recommend then for these people who are suffering from this post-birth control syndrome?
Yeah, that's a really great question, because as I bring these things up, people are always like, well, wait a minute, can I do nothing about it? Your body wants to heal. And so this is something that I've been working on for years, of developing protocols around. And I have found that absolutely you can reverse post-birth control syndrome. The loss of menses, like if the post-pill amenorrhea is what we call it, when you don't have your period return, that is something that can be more of a permanent state. If a woman, if that was developing, as a teenager, and then she was put on the pill for a couple, 10 to 20 years, somewhere in there, we're going to have a bit of an issue with that. Mm-hmm. But in general, what I see that really moves the needle right away is getting people on a good quality liver detox. And I recommend using professional grade supplements. So these are supplements that doctors can carry and recommend to patients. And the reason for that is because your liver is one of the major organs that takes a big hit with the pill. The pill depletes nutrients that allows it to actually process the estrogen. So it can't actually process the estrogen the whole time you're on it. And we know there's research surrounding sex hormone binding globulin, a protein that grabs onto your hormones. It's why women lose their libido on the pill, and that can go away and stay gone for good, is because the liver is actually affected at the genetic level by the birth control pill. So the first thing I tell women to do is let's take you through a detox. Let's do a reset. And that's what my post-birth control syndrome guide really is a 21-day detox. And it has some dietary components to it as well, like eating really healthy fats. If you're not eating healthy fats, and especially like coconut oil, which raises LDL, which is exactly how we make our sex hormones, if you're not eating those healthy fats, you stand no chance at getting your hormones back in balance. So I just want to say that in light of everything that's been going on recently. But with that, we take women through this 21-day detox. And it's all about the data in this. So this will help them feel better. It probably won't get you 100% better, but what we can gain in the data from that, how are you feeling? Were you having any hormonal symptoms? What was your digestion like? That can help us be very targeted and have a good understanding of what's left to clean up, basically. What else do we have to do? So I recommend women getting on a nutrient-dense diet, eating things and doing practices like drinking plenty of water every day that support detoxification, so you can start cleaning out basically all of those synthetic hormones. And on top of that, when you do that kind of supplementation, you're loading yourself with a ton of nutrients. You're going to get all those B vitamins back. You're going to get all those minerals that you need. And I find that most women at about 14 days into that are like, I'm feeling like a different person. Like I'm getting back to feeling more like myself. So liver detox and a whole foods diet is definitely a first step. And the other component to that is really getting that circadian rhythm fine-tuned. So the circadian rhythm is all about our dark and light cycles. And so here's just the basics of what I tell patients to do. One is when you wake up in the morning, open up your curtains and expose yourself to natural light. It doesn't matter if it's an overcast day. There's natural light there, and it's all about the eyes. So when I say expose yourself, that's not like opening up the curtains and you're naked to your neighborhood, expose yourself. Just open up your curtains and let the light shine in. And the reason why we need it's all about the eyes is because that's going to hit the pineal gland. It's going to say spike cortisol, drop the melatonin. And then what we do is we have women wear amber glasses at least 2 hours before bed. So those are those blue blocker glasses. They're super cute ones, ladies. Like as much as I love Dave Asprey, those glasses he wears, I'm like, I don't want to wear those all day. Those are not cute. They actually have lots of really cute ones that now that you can be wearing. So we do that so that melatonin starts rising, cortisol starts coming down. We're going to get all that yummy growth hormone at night so we can repair tissues. And so with that light-dark cycle, let me just say the last piece. Sleep in a completely dark room. If you turn off the lights and you can see where you're going, it's not dark enough in there. I want it like a cave because that's going to keep your melatonin up. And yes, melatonin's great for sleep, but it's really important to understand that if we've gained nothing else from all of these studies that we've done on nurses and night shift workers, it's that if you don't have adequate melatonin, your risk for chronic disease and cancer is much higher. If you've been on the birth control pill, certain cancers are going to be at higher risk, liver cancer being one of those. So one of the best things we can do is start bathing you in this rich antioxidant called melatonin. So the other piece of that is that we now know there was a research study published in May of 2017 showing us that if the circadian rhythm is disrupted, the liver doesn't function at its full capacity, which is a lot to think about. And so this is something that clinically, I had observed that if we can get that light cycle really dialed into women, the hormones start improving much faster. The symptoms start improving much faster. I am super grateful for that research study now because I didn't know why. I'm like, I don't know why. Here's all my hypotheses. And now to see like, okay, there's something to that light dark cycle as it affects all of your organs. And now we know the liver, which is primarily responsible for detoxing estrogen, is a huge player in all of that. Does that make sense? Yeah, I just kind of went off there for a little bit.
Does. And I think, this is great information because these are things that unfortunately, if you meet with your physician, they usually don't have time to go into this stuff with you. Because, the way that the healthcare system is set up, that it just doesn't give you time. And I think that's one of the benefits of seeing a naturopathic physician like yourself is that you have plenty of time with the patient to go over these types of things. Now, if you're interested in learning more about Dr. Brighten and about her post-birth control syndrome diet and these recommendations, very quick, go to drbrighten.com, drbrighten, so that's Brighten, en.com/PBCS diet. That's post-birth control syndrome diet. There is a free ebook, just a short guide for you, just to get started. Gives you some of the suggestions about the foods that you can eat to help you after you're off these birth control pills if you're having these types of problems. Now, what do you say then to those physicians who may not be concerned about these negative effects? Birth control pills, I would say, and I see 90% of my patients are women, and I would say probably realistically 40% of them are on birth control pills. So, obviously a lot of these family physicians and OBGYNs aren't concerned about post-birth control syndrome. Why do you think that they aren't concerned about it?
I just think they don't know. So that's been my experience is that, most doctors just really don't know. They were taught that the pill is not only fairly benign, but it's also one of the most empowering prescriptions you can write for a woman. You're giving her the option to control her fertility. Like that's a pretty amazing thing. And we can certainly acknowledge, I'll be the first to acknowledge that, without birth control pills, I probably wouldn't have made it. I'm a first generation college student and I became a doctor. And I look back and I spent 10 years on the pill. If I had gotten pregnant during that time, I wouldn't be here today. And we know from the research that since the pill has been introduced, women are seeing higher rates of college graduations, and we're also seeing our salaries increase. So, there is some power to taking that pill. But, the other thing about these conventional docs is that their toolbox is really limited. And so, when it comes to women's health, there's like birth control pills, mood altering meds, IVF, hysterectomies, and there's little talk in conventional medicine about a root cause approach, which is exactly what you were saying earlier. And why would there be? Why would there be this talk of root cause approach? Because, they're really trained for the extremes. And I'm super grateful for medical doctors because, if you get in a car accident, I don't want to see a naturopathic doctor for that. Like if I have cancer, I want a healthcare team that includes a naturopathic doctor, but I want to be consulting an MD as well. And so I think, in some ways, I think it's really unfair that, even myself as a patient, but, as patients collectively, that we go to medical doctors who are in that primary care setting or in that conventional model, and that we ask them for this root cause medicine because they're not trained for that. And in fact, what they're trained in is pretty amazing. And I'm super grateful for their training. I couldn't do what they do, but vice versa. They can't do what I do. I'm trained for the root cause resolution. And so, that's kind of, my perspective on it is that their toolbox is limited. They're not really trained for this, but they're trained to give you a quick solution to get you out of pain or, get those symptoms gone as soon as possible. They operate from a really good place in my mind. I think their hearts are really in it, but it's just something that we've got to be realistic about what we're expecting because they're just not trained in that way.
Yeah, well, and the way that the whole healthcare system is financed and set up is you can't treat patients that way. If you were to take that type of time to go into it with each patient, you go bankrupt. It's just not possible. You have to see it for certain types of specialties. You have to see 40 patients, sometimes more a day, and you just don't have time to do that. So, I completely agree with you. From me coming from an allopathic standpoint, I definitely see both sides. And when I look at myself, I try to think about myself as, okay, ideally I'd love to be an integrative physician, one that takes both Western medicine, but also incorporates a lot of the stuff that you guys are teaching as well.
I love that. That's fantastic.
So what do you recommend then for somebody to say, okay, birth control pills, they have empowered women, they have had a lot of positive effects on women in society and that, but what if somebody doesn't then want to go on birth control pills? What do you recommend that they consider for contraception?
Yeah. So the first thing I want to say is that it's not about what I think is best or what your doctor thinks is best. It's your decision to make. Only you can decide what's the best method for you. And for some women, they'll hear everything that I talk about and they're still going to say, hey, birth control is best for me. And if that's the case for you, then, we want to be supporting your health with that. But, when it comes to birth control pills, you've got to look at what's realistic for your life. So when it comes to alternatives, we mostly want to stay away from the hormonal versions because that's going to be suppressing our hormonal system. It won't, so I should say, so I think every woman should know this, that the American College of Gynecology actually classified your menstrual period as the 5th vital sign. So that's up there with blood pressure, respiration rate, pulse, temperature, these things we evaluate for vitality and for health. And so for women, your period is highly insightful. So if we give you a contraception, option that's hormonal, we're going to suppress that. We're going to lose really important data, in my opinion. So when it comes to alternatives, we're looking at usually things like IUD, a copper IUD. Now, some women listening to this are going to be like, wait a minute, what about copper toxicity? In the research, there's no evidence of copper toxicity from an IUD. It seems that there might be copper localized to the uterus, that there may be higher copper concentrations there. But in terms of throughout the body, not seeing it in the research. But I'll say, there are women reporting it, and I have ran tests on women and seen copper levels go up after the IUD. So that means it is a possibility. So again, it's got to be individualized, and we've got to track that if you're going to go with the copper IUD. If you have heavy, painful periods, you cannot use the copper IUD because it just makes all of that much worse. You got to come see someone like me. We got to do the root cause first, and then we can consider the copper IUD. Now, there's also a piece of technology that I'm a huge fan of. It's called the DAISY device, and this is based on fertility awareness method. Now, I've got a whole article on my website about this because I went to naturopathic medical school. I was taught never to recommend fertility awareness method because women can't do it, and it's just not a viable form of contraception. And everybody's taught this in America. When you go through any kind of health training, it's really funny when you look at the research because there are studies that show that with typical use, now the perfect use of the pill is fantastic, but with the typical user use, it's not as effective as preventing pregnancy. And what we actually see is that when it comes to fertility awareness method, because women just don't take a back seat to their fertility and their ability to become pregnant, it actually has really good efficacy rates because women are really dialed into their body. And so why I use the DAISY fertility monitor is quite frankly because I'm lazy about this, and I don't want to like getting out a pencil or even a pen and having to track fertility method on a piece of paper. That's just not, I'm not going to do that. I have low follow through. I'll admit that. But with the DAISY fertility monitor, all I have to do is I wake up in the morning, take my temperature. It takes just a few seconds, and then I plug it into my phone and it charts everything for me. And this is something a lot of my patients use because it's so simple. Green light means go. You're safe to have unprotected sex. Red light is stop. Don't have unprotected sex. We're only fertile 6 days out of the month. You can use a condom for 6 days. You can abstain. Yes, I guess that's a possibility, but I don't see anybody being really successful with that. And why I'll say abstinence is not successful is because about day 10 of your menstrual cycle, not yours, but women's day 10, they're going to spike testosterone. That's going to make them want to have sex. And the idea is that sperm's going to live for like 5 to 6 days. You're going to capture that sperm around day 10, and maybe around day 14, you're going to ovulate. So it's Mother Nature being super smart. I mean, she doesn't get it wrong. So that's why I'm like, I don't know about that abstinence business because it's hard. You have to override your physiology with that. So other forms of birth control pill, or not birth control pills, but contraception contraceptive devices that I tell women to look at is also things like, do you want to use a cervical cap? Do you want to use a diaphragm? Do you want to use something like a sponge? Most of the women in my practice are doing fertility awareness method in this way, because not only it's pretty easy to figure out how to avoid getting pregnant, but you get such good data. And they bring that into me. As you can tell, I'm a totally data-driven kind of gal. And I want women to start understanding how this data relates to what's going on. When you start figuring out where you're at in your menstrual cycle and what that looks like for you, it's kind of a superpower. You can totally biohack your menstrual cycle and start to understand, like, when am I more productive? When am I going to have more energy? When do I maybe need to hang out with my girlfriends? And when do I maybe need to get some alone time? And you start figuring this out, you feel less like a weirdo in society because our mood and everything does shift with our cycle. So that's why I'm a big proponent of fertility awareness method. But again, it always comes back down to what works for you and what works for you and your partner. It starts first with what works for you, and then you open up that conversation with your partner, because you got to know where you stand before you get swayed by somebody else, because you're the only one living in your body. You're the only one that can make the best medical decisions for yourself.
Exactly. And two things. First thing is there an app? Is there a name of the app that you can give to those people who are watching and listening today?
Yeah, so the Daisy Fertility Monitor that I was talking about, that's DAYSY, it has its own app that you can plug into if you're using that device. And then we use other period tracking apps like DOT. MyFlow is another good one. And so these days, it's so amazing, because I have patients come in my office and I'm like, what have your menstrual cycles been averaging? And they pull it up on their phone. They're like, my average cycle is this many days. And so using these apps, thank goodness for technology. It's pretty phenomenal. And, since we're just on the technology piece, I just want to throw out that actually in Sweden, they're now recognizing that these fertility monitoring devices are a form of contraception. In the US, we haven't come to the place of acknowledging that yet, but other countries are already acknowledging that fertility awareness method is pretty incredible. And these pieces of technology, because they're so complex in their algorithms, can help women be really successful.
Yeah, and I understand where some people would have reservations. My understanding is that the failure rate can be high if you aren't keeping track closely and really know what's going on with your body. One thing that honestly, I see patients all the time who ask me about these types of things, and really honestly, I tell them, I say, for contraception, if you're done having babies, have your husband get a vasectomy, darn it.
Yeah, there's that. I should have mentioned that.
It drives me crazy, because I do tummy tucks on so many women who've had children, they're done having kids, and then they'll ask me, I'll say, hey, can I have my GYN do a tubal ligation at the same time? And I look at them and think, it makes no sense to me that a doctor is going to cut you open. Even if you do it laparoscopically, you're still going inside your abdomen, whereas a guy can go into an office and do a little snip, and that's it.
Totally.
So I've had patients that have said that exact thing, that, I want to get a tubal, and I say, well, look, because of I had a patient, she was literally like a week before surgery, and she said, hey, I want to get a tubal, and I said, it's kind of late to schedule it. You're a week from now. And I said, well, have you talked to your husband about getting a vasectomy? And she goes, oh, God, no, he would never do that.
Right? Because the burden of pregnancy.
But he's okay with you having a 3.5-hour tummy tuck. And, hey, on top of that, let's open you up on the inside, too, and do a tubal ligation. It astounds me. Like, it's a man's world. It's sad, because guys need to, they really need to man up and get your darn vasectomies.
I really appreciate you saying that, because the reality is that the burden of pregnancy falls on the woman. It always does. We're the ones that are going to have to carry a human, around and give up our bodies.
And go through labor and have these babies. And then, like I said, for me, and then they come in to see me, they have a tummy tuck. It's a big operation, a 2-week recovery time. Yet, dude, you're not going to get a vasectomy? Like, what a wuss. You're a wimp. So... Anyway, so that's my 2 cents. Okay, quick question: have you got any pushback? You're really obviously very passionate about post-birth control syndrome. Have you had any pushback from big pharma or from GYNs about what you're teaching people?
Well, you'd be surprised. I've actually found that most doctors and healthcare providers are really interested in learning about this because they really want to help their patients. Like nobody becomes a doctor, because for any other reason, but really they want to serve and they want to help people. So, this is something that I've actually seen that a lot of docs are interested in it. Now, of course, there's going to be people who like cling really tightly to the dogma, and honestly, their best arguments are usually to call me names. I've actually had some, just readers or, fans call me names as well, which, ones like quack, of course we think of that, but the anti-Margaret Sanger, that was the most hilarious one that I got. And it's because, people misinterpret that I'm completely against the pill, and they think that I'm coming at this and I'm trying to disempower women and take something away that, has propelled women's rights. And it's not about that at all. And I think there are doctors who have spent so many years with the pill that they, prescribing it, to acknowledge that maybe all of those prescriptions were, one, unfounded, unnecessary, but also could have actually caused problems. Like, who wants to acknowledge that? If you've been prescribing the pill for 20 years, do you want to now hear that you could have been doing more harm than good? No, because the Hippocratic Oath, we all take this oath, and it is to first do no harm. So there's also that piece of like, that really challenges somebody like at their core belief system. And so I certainly understand that I'm going to get opposition with this, but the way I'm coming at this is like, this is not about what I think is best for you. This is about giving a true informed consent, about making sure that women know about their options and know about what can happen if you take the pill, and about getting the research into clinical practice much sooner. We know on average it can take a good 17 years before a research study that's groundbreaking makes its way into clinical practice. This is what we do different in functional medicine. If we've got a research article, we start to think about how to implement that clinically. So, for one example, we know it was about 5 years ago that a study came out of Harvard, and they actually said, there's such a high correlation between birth control pill and the activation or the onset of Crohn's disease that women should be genetically tested, or we should at least be reserved in prescribing this until we get that family history. And we know, because if that family history is there of Crohn's disease, we actually shouldn't be giving a woman that pill. I have talked to lots of doctors who don't even know anything about that study, who have never heard the link between birth control pill and autoimmunity. And it's really hard to know everything out there, right? Once upon a time, the family physician, like the primary care, could know everything and do everything for someone. We do need specialists like yourself now because we just know so much about the human body. So, that's really, I think the gist of it overall. And I think, the thing I have to say to people is that if you hear things that are controversial coming up, and then the first thing you see is that people start calling that person like a quack, and they start with the name calling, that usually means it's something worth paying attention to, because it's challenging the central dogma of society around that topic, and it's disrupting things in a way that makes people uncomfortable. Now, I welcome well-formulated arguments, and if you want to ask me questions, I totally welcome that. When it comes to the name calling and things like that, that just tells me that person's not ready for change. They're not ready to hear that what I'm saying, and that's okay. And we can just bless them and send them on their merry way, and maybe they'll come back around and they'll be ready for it, or maybe that's just not their path this go round in life.
So Dr. Jolene Brighten is a naturopathic physician. She has offices in Oakland, California, and in Portland, Oregon. She specializes in women's health and women's hormones. She has a free ebook. Go to drbrighten.com, drbrighten.com/PBCS diet. If you want to learn more about the post-birth control syndrome diet and how to treat that, I'd like to ask all my guests at the end of each show one piece of advice that they'd like our listeners and our viewers to leave with. So what would that be for you, Dr. Brighten?
That would be the little known fact that self-compassion and being gentle with yourself drops inflammation and optimizes your hormones faster than meditation, better than meditation. So actually talking to yourself in a kind way every day is better for you than meditation. So keep that in mind. The words that you use with yourself can be very empowering or very destructive to your health. And I really want to say that because of this topic. It's going to do you no good to go back and judge yourself for taking the pill or get mad at yourself for anything you did in the past. Now you can try to do better and really just focus on being kind, gentle, and loving to yourself, because you're the most amazing you and the only you that you're ever going to have.
I think that's great advice. Well, thank you so much for coming on the show, Jolene.
Yeah, thank you so much for having me, Tony. This was a great chat.
Thank you. Well, I'm Dr. Anthony Youn, America's holistic plastic surgeon. This is the Holistic Plastic Surgery Show. We'll see you next time. Do you want to look 10 years younger without having surgery? Well, my best-selling book, The Age Fix, will tell you how. I've spent the past 17 years learning the secrets to turning back the clock and have written all the best of these secrets in this book. This includes the Age Fix diet, simple changes to what you eat that can make a huge difference in your appearance. I'll share with you a simple skincare routine to keep aging and wrinkles at bay. And I'll share with you the best secrets to treat every single beauty and aging problem there is, from age spots to wrinkles, saggy skin to bad breath, saddlebags to hair loss. And almost all of these can be effectively treated without surgery. So are you ready to turn back the clock and kick Father Time's backside? If so, check out The Age Fix. Now, if you purchase it on my website, dryoun.com, you'll get over $10 off the cover price, free shipping, and you'll receive several free gifts, including a bonus chapter that you can only get by purchasing the book there. Thank you for making The Age Fix such a huge success.